Welcome back to COM 3693 Interpersonal Health Communication. Today we're going to address the intersection of health and technology. Specifically, I hope to answer the question of how do information and communication technologies affect health in our everyday lives by the end of this video. In this lesson, we're going to address technologies very broadly, looking at both channel affordances and the health content delivered through these channels. As a child, I remember looking forward to my doctor's visits instead of dreading them. Why, you might ask? It's because before each visit, I fondly remember playing with the different toys and reading the different children's magazines that my pediatrician had available for me. For example, as soon as my mom or dad would drop me off at the office, I would take out the wooden bead maze toy and play with that for a few minutes. Then I would open up any of the old highlights magazines we had on the table and either do the hidden object search or the Mad Libs and come up with what I thought were the most hilarious stories. Of course, when it was my time to go in and meet with my doctor, I would get called into the office and we would see each other face to face. This was the norm with both annual checkups and when I was feeling under the weather. When I would go and see my doctor, he'd ask me questions about my schooling and any extracurricular activities I was engaged in, and then simple questions about any medical issues I was experiencing. The landscape of medicine was very simple some 3 decades ago. It was come and see the doctor in person or not at all. But within the last 2 decades or so, our options have dramatically broadened. No longer do we need to drive over to the doctor's office, wait to be seen, and then receive any prescribed medication. Instead, it's now as easy as opening one's phone, making a quick appointment to speak with a medical professional, get a diagnosis, and start any intervention or treatment without sometimes even having to leave one's home. Here's a personal example. I recently woke up with a red, itchy, irritated eye. I went online to seek information about what it might be and how I could fix it by putting my symptoms into the search field of Google Chrome. Despite putting a cold and then hot press on my eye for several minutes over the course of the day, the irritation simply would not go away. Rather than drive down to the nearest clinic near my house, I decided to get on my smartphone, log into my Blue Cross Blue Shield account, and go into MD Live and speak to an on-call physician in a matter of minutes. During the visit, the physician asked me some background questions about my medical issue and then asked me to turn on my camera so she could look at the irritation. She did a quick assessment, explained her medical diagnosis, created a prescription for my medication, and then sent it to the nearest CVS, which was only minutes away from my house. This visit to a medical provider, which would have otherwise taken at least half of my workday, was completed within 30 minutes from the moment I decided to see a doctor about my issue. This example underscores the competitive and comparative advantage of telehealth. Here are a few statistics to underscore the significance of telehealth. In the United States, 37% of adults aged 18 and older have used telehealth services in the past year. Women more than men are likely to report using telehealth services. Likewise, ethnicity seems to play a role in one's decision to use telehealth. Non-Hispanic American Indians and Alaska Natives were most likely to use telehealth services, followed closely by individuals who identified as non-Hispanic white at 39.6%. These had higher proportions of telehealth use than Hispanic people, non-Hispanic Asians, and non-Hispanic Black Americans, who reported estimates at around 33%. Finally, education level played a dominant role in one's decision to use telehealth. As the level of traditional schooling increased, so did the likelihood of employing telehealth services in one's own life. Telehealth services represents a rather substantial share of the market, with revenues nearing $100 billion globally in 2023. Telehealth is expected to grow exponentially in the coming years, with projections estimating the revenue of telehealth services will be nearly $300 billion by 2030. But insurance providers and healthcare professionals alike are willing to make large investments in telehealth because they know it will save them time and money in the future. Take this example of a multi-year experimental study conducted by the Center for Medicare and Medicaid Services in 2006, which assessed a sample of patients at 2 clinics in the Northwest who had been diagnosed with heart failure, chronic lung disease, or diabetes. The pool of patients was randomly assigned to a control group or a treatment group. The control group was not asked to do anything differently. They were to live their lives following the same routines they always did. But patients in the treatment group were asked to use Health Buddy, a home telehealth unit linked by telephones to care managers. Those in the treatment group checked into Health Buddy daily, providing information about symptoms, vitals, and health behaviors. When concerning data was inputted into Health Buddy, care managers would follow up with a phone call. The results of the study were groundbreaking. Compared to the control group, the experimental group participants had slightly lower risks of mortality, and their care cost savings were on average $1,048 to $2,168 more per year. The things that can be done between patients and their providers through telehealth services extend well beyond having a conversation through interactive video conferencing devices. Healthcare professionals can share radiologic images, images from electronically enabled otoscopes of one's inner ear, an ophthalmoscope image, and remote monitoring of things like blood pressure, weight, and even activity. And continuous monitoring of patients' vitals has significant untapped potential for improving health outcomes. For instance, a study by Soumya Chowdhury and her colleagues from Behavidence, a research and data science company based in New York, analyzed the relationship between 37 digital behavioral markers of 558 smartphone users and their propensity to experience depression. The digital markers were used to create a mental health profiling metric, which was found to correlate strongly with self-reported depression. What does this all mean? At least according to Chowdhury and Associates, monitoring of passive, unobtrusive smartphone data distinguishes those who have depression from those who don't have depression. Of course, the most common telehealth services we use on a day-to-day basis involves interpersonal communication with our primary care providers. There are two ways in which we communicate directly with healthcare providers through telehealth services. The first is called real-time or synchronous communication. Real-time communication involves quick back and forth exchanges of live messages. Both parties are sending and receiving messages, and very little latency is assumed between each utterance. The second type is called store and forward or asynchronous communication. In this model, some degree of latency is assumed as senders and receivers are not necessarily on the same channel at the same time. Email and web-based messaging, like through my chart pictured here, would be examples of store and forward communication. Interpersonal communication skills through technology-based systems are the bedrock for successful provider-patient relationships in telehealth contexts. But few professionals possess the experience to navigate the world of telemedicine. A qualitative study undertaken by Beverly Henry and her associates in 2018 interviewed 6 practitioners, including both physicians and nurses at multiple regional telehealth centers, about their perceptions of interpersonal skills necessary to provide care through telehealth. They were asked open-ended questions about their experience in telehealth and how they diverged from more traditional face-to-face methods for delivering healthcare. Here's how they responded. From a pre-interactional basis, there was a need on the provider's part to be aware of the patient's benefits for performing telehealth. Sentiments like, quote, "The patient really appreciates not having to travel distances to see their provider, and in many cases preferred over face-to-face," end quote, were raised. Providers also need some competency and self-efficacy over the technology and carry with them a positive attitude toward telehealth in general. The next theme mentioned was verbal communication competence. Things like ensuring you don't step on the last sentence of the patient while they're speaking, or effectively delivering patient-centered care through the computer were mentioned to support this theme. The next theme was nonverbal communication competency, where providers mentioned how, quote, "they needed to know how to make eye contact when looking at the camera," end quote, creating immediacy through body language by not moving around and providing positive feedback, and having screen etiquette, having a camera on at all times and a camera presence. The fourth theme is relational communication, where providers say they needed to be aware of rapport building, privacy as they were invading their patients' personal spaces, and emphasizing empathic communication. The fifth thing mentioned, awareness, meaning that they had a keen awareness of environmental costs and benefits given that the provider patients were geographically distributed. Observations included a desire to not let technology become disruptive to the exchange, maintaining confidentiality of the communication, and providing a safe environment for the patient to disclose any information was important. Finally, education was mentioned as an important part of healthcare using telehealth. Some doctors said, quote, "We need to work with health plans and universities on how to train the next generation," end quote. And they thought that they needed a checklist of items that they can use to deliver patient-centered care through technology-based systems. The advent of social media has also changed the landscape of patient-provider interactions. Although patients rarely communicate with their healthcare providers through social media, they nevertheless gain information and feel empowered to communicate effectively with their doctors by using information they learn through social media. In an article entitled "How Patients' Use of Social Media Impacts Their Interactions with Healthcare Professionals," Arcelio Benettoni and his colleagues asked 36 social media users with chronic conditions about how social media use has altered the way they communicate with their providers. Three broad themes were derived from the focus groups with these social media users. First, social media use undoubtedly influences their interaction with their healthcare providers by making them more prepared for their doctor visits. One person said, "I think healthcare providers probably take you a bit more seriously when you know your stuff, because they can't fool you, because they know you have all the answers from social media." Another theme was that social media helps with decision-making processes of what to do with interventions or treatment. Another participant said, "I was having trouble with a high blood pressure tablet. I was getting dizzy, sick, and I said to the doctor, 'There's something wrong with me.' He said, 'Just give it some more time.' So when I went onto the forum and people had the same problem, they said, 'Tell your doctor he's wrong and get off that, and tell him you want to try drug X or something else.' Then I went back to the doctor and I told him, and he changed the medication. Perfect. But if I stayed with the doctor's advice and never checked it for myself, I'd feel sick all the time." Finally, social media changes the need for healthcare services like face-to-face meetings for some chronic patients. One participant said, "Maybe it saves you the trip to the doctor because you're informed by what's on social media and can go directly to the pharmacist." It is, however, important to note in a communication class that some of the information available through social media is not entirely truthful and contains falsehoods and inaccuracies known as misinformation. A systematic review of literature of all articles published on misinformation and disinformation found that health misinformation appears rather prevalently on social media. They found health misinformation was most prevalent in studies of smoking and drug use, with post-analysis containing as much as 87% of misinformation in some studies. This was followed by misinformation of vaccines, eating disorders, non-communicable diseases and pandemics, and the lowest rates related to medical treatments. That's pretty much all I have for this module on communication technology and health interactions. In this module, you learned about the definition, statistics, and efficacy of telehealth services. You learned about different ways in which providers communicate interpersonally with their patients through technology-based services. You also learned about the complex considerations these providers need to make in order for them to be successful and effective in providing patient-centered care through technology. Finally, you learned about patients' use of social media and how that can have important implications on the provider-patient relationship. As usual, if you have any questions, please drop them in the comments of this video or feel free to email me. Thank you for watching, and I will see you again next week.